Evidence against Professor Ferguson, images 1 to 49. These are the supporting images for a document comprising our evidence against Professor Ferguson of Imperial College for his ICCRT Report 9, Figure 1A, 510,000 UK deaths. Note to censors: we use only government data. If you have a problem with the results, speak to the government. These are images to support a prosecution, actual or available as required. As such, they do not purport to form a narrative in the sense of an ordinary presentation or video. Images are typically grouped by a topic. An image number is associated with each image. Each image has a slide with a smaller image and brief text to provide context, and a following slide with the image in full screen. We have over 290 images at the time of writing and will present approximately 50 images per presentation or PDF. A link to the PDF will appear in the video description. Images are free to use and share, but we retain copyright. Images with COVID data are based on official government data. Use wisely. Attempting to misrepresent our work either to overstate the case against the government or to discredit our work or person may be treated as defamation. Contents, more contents, more contents, and even more contents. Last bunch, almost, and we'll get going. The Imperial College COVID-19 Response Team Report 9, March 16, 2020. On the 16th of March 2020, Professor Ferguson, PF, published Imperial College COVID-19 Response Team ICCRT Report 9 Impact of Non-Pharmaceutical Interventions NPIs to Reduce COVID-19 Mortality and Healthcare Demand ICCRT R9. In ICCRT R9, Professor Ferguson describes a model, but not explicitly. It is referenced as previously published. On page 4, Professor Ferguson sets out a number of parameters. Incubation 5.1 days. Seeded exponentially with a doubling time of 5 days from early January. Rate of seeding to reflect cumulative deaths in GB or US as seen by March 14, 2020. Professor Ferguson sets out further parameters: 40 to 50% asymptomatic, not identified as cases, IFR 0.9%, 4.4% hospitalized, mean hospital stay 10.4 days. On page 5, Professor Ferguson sets out the infection fatality rate by age. On pages 6 and 7, Professor Ferguson sets out the default projection for an unmitigated contagion. This includes the key figures of 81% infected, 510,000 UK deaths and 2.2 million US deaths. On page 7, Professor Ferguson sets out in Figure 1A the default projection for an unmitigated contagion. This includes the key figures of 510,000 UK deaths and 2.2 million US deaths. By setting the background to transparent, demonstrated by underlying rectangles, and eliminating the US curve, we obtain a reference curve to overlay on, for example, Excel charts. The red notation is to increase the scale to per 100 million population. We can fill the section of the curve and the axis which are erased in removing the US curve with an approximate line for the curve and a horizontal axis in different colors to emphasize that these are additions. Diamond Princess. Wikipedia records the demographics of the Diamond Princess COVID-19 contagion. Wikipedia records the cases of the Diamond Princess Covid-19 contagion. World Health Organization publishes China provinces breakdown of cases and deaths up until March 15, 2020, when the China contagion was essentially over. This includes Hubei, home to Wuhan, and was available prior to the ICCR-TR9 publication. Constructing a data history for Hubei, China, this is the first page of data. Constructing a data history for Hubei, China, this is the second page of data. By integrating with China data and making common sense adjustments, we arrive at a reasonable dataset for Hubei, China, page 1. Final Hubei data, page 2. Hubei cases to 15th of March, smooth 7-day centered average, raw data in the background, autofit normal with actual growth and autofit growth decline. A normal contagion, this was available to Ferguson prior to March 16th. Annotated slide to assess whether Hubei lockdown altered the trajectory of the virus. If it did not, and it does not, then lockdown had no effect. Ferguson had no reason to ignore this or even to modify its numbers for lockdown. The Hubei death data to March 15, 2020. To assess deaths for lockdown effectiveness, we need the cases deaths lag to know when deaths would first be affected by lockdown. Cases deaths lag is the time delay between peak cases and peak deaths, how long it takes to die. Assessing the effect of lockdown via Hubei deaths. If the lockdown did not affect the trajectory of the contagion, then lockdown had no effect. There is no change, no effect. Ferguson had no excuse to ignore Hubei data or adjust for lockdown. Chart familiarization, growth, normal, exponential, log and linear scales. Introducing growth, today's cases over yesterday's cases, using an arbitrary non-COVID, non-normal chart. We use the sine curve. Growth is simple arithmetic that can be applied to any data or curve. Growth of a normal curve. Growth is expressed as a factor, today's value over yesterday's value, though we may use averages for smoothing. 2 is doubling, 1.15 is 15% per day. Growth, today over yesterday, is not gradient, the increase of today minus yesterday. Gradient means the curve appears to accelerate to start with, curving upwards, then decelerate, curling over. But those are artifacts of linear arithmetic, not growth or geometric arithmetic. A normal curve and an exponential curve both have the characteristic curling up or acceleration at the beginning, making it easy for politicians to sell you an exponential virus that is never exponential. Log scales easily reveal the fraud of the exponential. An exponential curve is a straight climbing line on log scales. A normal curve, and contagions are overwhelmingly normal, including COVID, describes a dome or humped trajectory. A normal curve presented in linear, classic bell curve, and log, dome or humped form. The dome illustrates that a normal in fact proceeds with a smooth growth trajectory like a ball thrown through the air. The linear form is misleading. Growth is a critical concept. The growth of an exponential is constant. 1, 2, 4, 8 is equal to 1 times 2, 2 times 2, 4 times 2, 8 times 2. The times 2 is a constant. It plots as a horizontal line on a chart. Here the growth rate is 1.2, so it's times 1.2 times 1.2 times 1.2, etc. UK COVID experience versus the world. Half the world had a very different experience of COVID to the UK. Here's data to late January 2021, with half the world, Africa and Far East, brushing off COVID again, with only 2 countries even beginning to have a UK-like experience. Deaths are recorded per 100 million population to create a level playing field. Only South Africa and Eswatini have notably Western-style contagion in Africa. No anti-malarial drugs regularly taken there, perhaps. To not make a phone call is criminal. To have 2 contagions, spring and winter, hundreds of times worse than the Far East, is not chance. It's not unfortunate. It is engineered by policy. No one is that incompetent. It's a strange contagion that attacks more aggressively the closer you get to a Western political headquarters, the UK or EU Belgium or USA New York City. Here's the Middle East, not as far away and safe as Africa and the Far East, but not as bad as Europe. Now we have the Americas, and we're finally joined by a pack of countries including the USA. How strange that these countries don't have telephones to ask how Africa and the Far East did so well. Home territory, Europe, and we finally have kindred spirits joining us, and leading the way as it has throughout the crisis, the worst hit nation in the world, EU headquarters Belgium, showing us how it's done. If you are asked what the UK, EU HQ Belgium and the USA had in common, what would your answer be? Leaders of the free world? How free do you feel right now? And why didn't our leaders make a few phone calls? Or is it something else? World ranking as worst hit by deaths per 100 million, equivalent to deaths per million, but scaled. EU HQ Belgium has never relinquished its number 1 slot since it reached it. The UK managed number 3 in the spring and number 3 in winter. Curiouser and curiouser. Republic of Korea. Republic of Korea, aka South Korea, aka Korea RO, aka Korea, the Western one. The World Health Organization data for cases and deaths. Korea was over for cases, we ignore minor tails when describing a contagion as over, and should never have been ignored by Ferguson. Korea cases and deaths data raw, not smoothed by averages, daily for cases and deaths and total deaths. Total cases omitted, as it would outmatch the others, so we'd lose this display. Korea cases and deaths with centered 7-day averages and raw data behind in pale colours. Cases was over by March 15th, the day before Ferguson published. He had no excuse to ignore this data. Korea data with autofit normals, including an alternate normal for cases. Early cases were likely not confirmed and therefore omitted. That may explain the slight asymmetry in cases. Regardless, Ferguson had no excuse to ignore this. Career cases with the auto-fit normal to peak and the alternate normal for post-peak. Actual growth is plotted, as well as the theoretical growth for the two normals. As must occur to match a humped curve, growth declined rapidly. Career's distinctive double-humped, treble-even curve in deaths is interesting. Would love to know the story, but it's not material to the UK experience, so it's not investigated. The overall level of deaths and case death lag is material. Ferguson claimed to fit the UK for deaths to March 14th prior to publication on the 16th March. As such, this is what he could have seen and probably did had he chosen to look at South Korea. A virus brushed off with ease. Would that be his story for the UK? Korea cases and deaths to March 14th that Ferguson could have seen and probably did. Deaths would have seemed remarkably slight, as indeed they were, but even more so. A phone call could have confirmed how many were ill. Cases and deaths to March 14th, as Ferguson could have seen. We have previously illustrated the background raw data. We now omit it by default and display only the averages. Ferguson had no excuse to ignore such extraordinarily good results for near complete cases. Career cases and deaths to March 14th with actual and auto-fit growth decline. You cannot draw a humped curve without growth declining. It is flat, unity as a factor, or 0 as a percent at peak. Career was normal, excellent, and not scary at all. Does that sound like Covid UK? With hindsight, we know that there were more deaths to come, but not many. The case fatality rate, CFR, would have been a clue, an easy thing for a government scientist to check. Make a phone call. There was no excuse for a scary story in the UK. United Kingdom, primary contagion March to June 2020. UK cases 7-day centred average with auto-fit normal dotted blue and growth rate actual purple and dotted descending line theoretical from auto-fit. Dots are actual growth values versus solid line average. Measuring UK lockdown effectiveness. Lockdown didn't change the trajectory of the contagion in the slightest, which continued normal in the curve and in growth. However, there was a massive change at peak. The virus doesn't track peak. Politicians do. Measuring the effectiveness of lockdown in UK deaths. This requires an extra delay, first is incubation, to wait for case death lag. Again, the deaths proceed entirely normally in the curve and in growth with no divergence as lockdown should become effective. A scenario as a metaphor. Ferguson evaluating a 4x4's miles per gallon. To illustrate Ferguson's approach to the available data, we consider a familiar everyday topic, assessing the miles per gallon of a new car. That's it for this package. I'm Andrew Mather, a 60-year-old Brit, mathematician, financier, technologist, husband, biker, pilot, healer, whatever. Feel free to get in touch, andrew@peerlessreads.com or andrew@amather.com. Either should get to me.